Dr. James Davis.
Continuing on the topic of staffing and back to Joe Mountfield, if that's okay, you talked about the complexity of requirements for staffing. For clarity, it's not just consultants, is it? It's also midwives, paediatricians, presumably. I wonder if you have a list of all the professions that you think might be considered.
A list of all the professions. So in terms of the acute labour ward setting, so who do we have there? We have midwives, we have healthcare support workers, we have theatre staff, we have theatre practitioners, we have anaesthetists, of course, really important part of the multidisciplinary team, and we have paediatricians, we have advanced nurse practitioners who are working in the paediatric team, and I could go on, basically. It's a wide multidisciplinary team that deals with many aspects of looking after women from the moment they get pregnant to the minute they leave our service. And so that's including physiotherapists, a huge number of different that provide that service. So it's complex. It's not just about doctors. It is about the whole team coming together and providing a seamless service. So, yeah, I can give you a list. Write it down for you.
No, well, I've worked in a labour ward myself, so I have a rough idea. But from what
experience,
from what you're saying, it now isn't the time for national mandatory staffing levels to be imposed because we simply don't know what those should be, and there's so much variation between units.
Yeah, so I mean, you can't come up with a simple figure that goes, if you've got this many babies, then you need this many obstetricians, you need this many. That's not the right way to go about this. There is a way of going about it, and we're really happy to be involved in that. But it has to be done properly, because the danger of doing it not properly and just coming up with sweeping generalisations is that what happens is that people focus all their attention of meeting the national standard because we've been told we've got to meet this, and actually then something else is lost in that because you're losing another vital bit of the service because we haven't got enough staff to do other bits as well. So let's do this. If we're going to do it, let's do it properly, and let's get some real nuance around this and support our multidisciplinary teams to get the right workforce. We've got the right staff in the right place, doing the right things to make the safest service that we possibly can. And that's what we're all in it for. Absolutely.
Great. And do you think there are any learnings from other professions in the UK in terms of minimum staffing guidance, or in fact abroad looking at obstetrics?
So there's not an awful lot abroad. I would say there's some interesting data from the American College around what maternity units can provide, and they have different tiers of maternity units, and there may be something for us to look at there. But we run a different service from other countries, and that comes back to the point about your clinical negligence scheme not being exactly the same. We have to do something that's bespoke for us. That's not to say we shouldn't look abroad for some ideas to bring back to that. Within our own community, within doctors within this country, yes, of course, other people have done some work that's around staffing levels. I think that's tended to be in less complicated areas of work. It's much easier if you're doing one job. If you're an ED consultant, you go and do ED. You don't do colposcopy, labour ward one day, an antenatal clinic, etc., etc., etc. So it is more complex.
Yeah. Gill, I can see you nodding. Do you have anything to add in this respect?
Just to say that I do agree with Jo. One of the things that she missed off her list was ultrasonographers, that obviously are really important in maternity services around supporting the multidisciplinary team, and we know there is a shortage of sonographers. Again, Health Education England, through Workstream 5, has been doing some work around trying to increase those numbers, but I think there's still a way to go there to support all of the services that are required.
Thank you. So finally from me, in terms of this committee making recommendations, would you be suggesting that we need to encourage government to provide funding to make these studies take place to look at staffing? Yes.
Yes.
Okay, thank you.
Thanks, James.